So I'm going to turn from our conversation this morning talking about patient access and the right of patient access to talking about not just how important that is for consumer engagement, but we have to go beyond the right to access and try to make it easier for patients to access their information. So the increasingly popular symbol that we have used for that is the blue button. You'll have noticed I changed my grandmother's pin in for my blue button. So there are blue buttons available for everyone here. If you do not have one, go and get your blue button pin to support this movement about patients having access to their information and being more engaged in their care. In 2011, ONC became the primary steward of the Blue Button Initiative and was charged with taking it nationwide. To support that effort, ONC, in close coordination with our federal partners, established a Blue Button Pledge. We now have over 500 organizations that have committed to increasing patient access to and use of health data. We've also been working to advance technical standards for sharing data with patients, and we're embarking on a campaign to educate consumers about the value of having information at their fingertips. We have been very fortunate that this initiative has been supported by the Presidential Innovation Fellowship Program for the past 3 years, and one of our former Blue Button Presidential Innovation Fellows, who is now at the White House, is up next. I am pleased and honored to introduce Ryan Panchadsaram. He serves as the U.S. Deputy Chief Technology Officer at the White House. Ryan was part of the inaugural class of Presidential Innovation Fellows, where he worked with ONC and the Department of Veterans Affairs on Blue Button. Prior to serving as a fellow, he was the head of consumer and product at Ginger.io, a spinoff from MIT Media Lab, using big data to transform health. Please join me in welcoming Ryan to the stage.
Thank you, Jody. It's an honor to be here. My name is Ryan Panchadsaram. I'm the Deputy Chief Technology Officer for the United States, and this movement means so much to me. But before I get into my talk, I'd actually love to start to share this stage with through a video with Lygia Ricciardi and Todd Park talking about Blue Button. So I think there's a video.
At the highest level, it's this concept of patient empowerment through access to health data.
This patient dimension of what's going on is perhaps the most exciting, right? The whole idea that these manila folders are not just turning into electrons, right? But they're turning into electrons that I, as a patient, can actually get, and I can share with people that I trust. And of course, Blue Button movement is the epicenter of that action.
The Blue Button Initiative really started in 2010 when the Veterans Administration put a little blue button symbol on their patient portal for veterans, which meant you can click this button and you can get an electronic download of your health information. What does your health information or your health record look like? It's a list of medications, it's usually a list of your conditions, some basic information about you and your health history. So veterans really loved it, and they started to really use that service. So much so that others took notice. The Department of Defense, the Centers for Medicare and Medicaid Services also has a lot of health information to share. They serve through Medicare about 40 million Americans. The idea was taking off.
There's all kinds of data that says, look, better informed patients, mean better outcomes for those patients, right? And so there's all kinds of innovation happening to try to take this data and this information to put it in the hands of the patient so they can actually pick the best doctor for their family, right? So they can actually understand better how to care for what they've got, right? So they can actually be a better and more involved partner in their own care.
It seemed so simple. It was really a way of crystallizing this idea of consumers getting access to their own information and, again, being empowered by it. So a couple years later, we at the Department of Health and Human Services, working closely with the White House, said, great, we think this is something that shouldn't be available just to folks who are maybe served by the government. We really want it to be nationwide.
It's of paramount importance to protect patient privacy, right? Paramount importance, right? And the principle at the heart of Blue Button, right, is that I, as a patient, right, can get secure access to my own data.
You're just pulling records from entities that already hold them.
This is actually a relatively little known fact, which we had to clarify. HIPAA actually says patients have a right to their own data, right? This is in HIPAA. It's enshrined in HIPAA, right? And then we furthermore have clarified this recently to say that includes getting a copy of your own electronic information.
When we talk about health data, we often talk about the health record that your doctor has, but there's health information about you in lots of different places. Your health plan knows what kinds of procedures you've had and what they cost. So you've got clinical data as well as financial data in there. In some ways, the crux of the most useful data for many people is from pharmacies. What medications are you taking? How long have you been taking them? What are the ones you actually ordered and picked up? Which is more accurate, in many cases, a picture of what you're actually taking than what your doctor prescribed. What you do with it is up to you. Some folks will put it in a repository, some would call it a personal health record. Others will choose to forward it to another doctor to coordinate their care, or maybe again to another caregiver in their family, like your kid or your husband or your mother. Others will plug it into an app or a tool that helps them analyze it.
It's the patient's data. That's the thing, right? The principle that actually sits at the heart of the whole Blue Button movement, right, is that patients should be able to get secure access to their own information, to their own data. And that very simple principle, I think, is one that if we follow as a country, can help unlock all kinds of good for patients.
Thanks, Todd. Thanks, Legia. So not so long ago, I was a Presidential Innovation Fellow working with ONC on Blue Button. But many of you came before me. Like Legia said, this movement started in 2010 when the VA added a small little blue button on My Healthy Vet to let a vet download their records. I'm actually kind of curious, how many people in this room were either working on Blue Button or came to this event in 2010? Awesome. Keep your hands up for a second. How about in 2011? 2012? 2013? Fantastic. And then 2014? Everyone's excellent. Okay, so you are this movement. Blue Button is you. Access to information is such a powerful thing. Just seeing a physical or digital copy of your record can help you better understand your health. It can help you catch and fix a mistake. It can empower you to share a more accurate picture with those that are taking care of you. Blue Button is a symbol for data providers to use that means you can get access to your health records here. When I say data providers, I mean those who hold data about us, like my doctor, my health plan, and even my personal health tools. They all can use the Blue Button symbol to signify access. For those that don't know, the Blue Button Initiative is a national public and private collaboration to encourage more data holders to provide patient access to the electronic records. Today, there are about 500 partners that support this movement, and it's growing. There are so many more partners now today than when I was a fellow, so I actually wanted to go back and see what changed between now and 2 years ago. So I went to my notes and took a flip through to see what the top concerns and doubts the larger community had about unlocking these records. And there were 4 that stood out. The first was, will open work? The second was, will seniors engage? The third was, will developers understand how to implement Blue Button? And the fourth was, well, Google Health failed. Why is now different? And so these are pretty tough questions to answer 2 years ago, but a lot of things have happened. So the first question, will open work? So there was a fear that providing access to a patient's record would cause confusion for patients and also add extra workload for doctors. Thankfully, an evidence-based study was done by Beth Israel Deaconess, Geisinger Health System, and Harborview Medical Center, looking at about 10,000 patients and over 100 doctors for a year, and found that open does not add extra work to a doctor's workload. But the real nugget was that it found that patients with access felt more in control of their care and report a better understanding of their medical issues. Open works. The second question was, will seniors engage? There was a concern that the technology investments like Blue Button would only benefit the young. For it to really help, it needed to work for older people. Over the past 2 years, the team has been seeing an increasing number of seniors signing up for Blue Button on mymedicare.gov. And in fact, just 2 months ago, CMS celebrated its millionth Blue Button user. So hats off to CMS for achieving that big milestone. The third question was, will developers understand how to implement Blue Button? Because there were a lot of questions from the development community on standards beyond a simple text file or PDF. Thanks to an incredible group of developers volunteering their time, there's a number of resources out there to help developers structure their records as well as transmit them. From the Blue Button Direct Implementation Guide to the CCDA Scorecard to the Blue Button Toolkit, the Blue Button Trust Bundle, Blue Button JS, and BB Clear, there are a number of resources for developers to tap into. But what we need now is startups and entrepreneurs and innovators to keep on doing what they do best, which is innovating. But you also need to help us learn what works and what does not. We need your help developing best practices and models for information to ensure information flows as seamlessly as possible. I bet you've noticed as you've created your data-rich applications, we've been hearing you be vocal about things like APIs. We've seen the benefit of APIs in complex industries like finance and telecommunications. A well-designed API can transform an entire industry. Just look at Stripe and Twilio to see that happen. And so when I say this word, FHIR, if you have the urge to run out of this building, please don't. Look it up. It's FHIR. It's one example of a RESTful API that's going to start providing granular access to patient data, which is key to building even more meaningful health applications. And so if you're a developer in the room, look it up and start participating in that community because we really need your help. And the fourth and last question was, Google Health failed, so why is now different? So Google Health shut its doors in around June 2011, and many suggested that its shuttering was a sign that consumer health applications would not be successful. But if you actually dug deeper into why they shut down, it was because of low adoption, and it was incredibly hard for people to get data out of their existing systems into Google Health. In a lot of ways, they were too early back in 2011. Today, health data is more available than ever. If you look at the recently launched Blue Button Connector, which you're going to get a demo next, you'll see what I mean. Today has also been the best time ever to be a health entrepreneur. There have been a record amount of investments in the digital health space. According to Rock Health, last year, close to $2 billion was invested in this space. That's over 186 companies receiving more than $2 million each. And even better, according to Rock Health's mid-year report, which they released 2 months ago, they've already raised $2 billion, like the community has raised over $2 billion in just the past 6 months. And so the energy's there. And oh yeah, by the way, Google is back, and they're taking another shot at empowering patients through their health information toolkit called Google Fit. So a lot can happen in 2 years, and it excites me to see what's coming up ahead. As a government, we are more committed than ever to Blue Button. Under the leadership of Dr. Karen DeSalvo and the team at ONC, patient engagement is a critical part of our strategy. As Karen mentioned earlier, policies such as meaningful use and changes to HIPAA and CLIA are making it easier for patients to exercise their legal right to access health information from the various places it resides. Also, a nice little announcement that we're able to make today is that emergency situations present a powerful use case for why it's so important to have health information stored securely and accessible. This is why I'm excited to announce, as part of the preparedness strategy, FEMA is going to be including Blue Button content as part of ready.gov. So you're going to start seeing over the course of the year FEMA incorporating Blue Button concepts into their national preparedness checklist. The VA and DoD also continue to be strong partners of Blue Button. At the VA, who essentially ensures our nation's veterans are able to access a wide range of providers, Blue Button's an important part of veterans being able to take their records and visit providers that they wish to see. And similarly, the DoD continues to provide our active duty service members and their families with easy electronic access to TRICARE Online. And to further expand the Blue Button family, because it's so important, the Indian Health Service is going to be launching a new patient portal this winter. The White House and HHS are also continuing to invest in talent from the private sector to help advance Blue Button. Blue Button has been selected again, third year in a row, as a high-priority project from the Presidential Innovation Fellows. Today, we're excited to welcome a warm welcome to Gajan Sunathra, our Round 3 Presidential Innovation Fellow, and also a huge shout-out to all the former PIFs in the audience, Adam Dole, Henry Way, Nyan Jane, Matt McCall, and Tom Black. Thank you so much for your service. HHS is also bringing an entrepreneur into CMS to support the MyMedicare.gov team. In the latest round of HHS entrepreneurs, there's going to be a talented innovator working alongside Niall Brennan from CMS to improve beneficiary access to health information. And so to close, I want to say how important this room is. You have to realize the work that you all have done over the past year has made it possible to see what's happened today. We have so much to celebrate, but our work is still not over. We all need to be the constant reminder that patient access and engagement is so crucial to improving our health system. We need to keep advocating for it in our own unique ways, whether that's creating new partnerships and companies, whether that's writing new code or building tools or building libraries, whether it's conducting studies or actually publishing best practices. It's up to us to keep building this important community. And so with that, I thank you so much for your time, and let's keep fighting together. Yeah.